a system where we're going to work with your employers to lower your premiums by up to $2,500 per family per year. We will start by reducing premiums by as much as $2,500 per family. Here's what changes: saying to people who already have health insurance and the employers who are providing it, we'll work to lower your premiums by up to $2,500 per family per year. I also have a health care plan that would save the average family $2,500 on their premiums.
And if you already have health care, then we're going to reduce costs an average of $2,500 per family on premiums.
We're going to work with your employer to lower the cost of your premiums by up to $2,500 a year.
And we'll cut the cost of a typical family's health care by up to $2,500 per year. And if you've got health care, we're going to work with your employer to lower your premiums by $2,500 per family per year.
And we will lower premiums for the typical family by $2,500 a year.
And cut the cost of health care by up to $2,500 per family. And if you already have health care, then we're going to work with your employer to lower your premiums by up to $2,500 per family per year.
Barack's policies will provide health care cost reductions of about $2,500 for the typical family.
It's time to bring down the typical family premium by $2,500, and it's time to bring down the costs for the entire country. And if you already have health insurance, we will lower your premiums by $2,500 per family per year. We're going to work with your employer through a catastrophic reinsurance plan to lower premiums by about $2,500 per family per year.
The only thing we're going to try to do is lower costs so that those cost savings are passed on to you. And we estimate we can cut average family's premium by about $2,500 per year.
And we'll work with your employer to lower your premiums by $2,500 per family per year.
Barack Obama will provide rural America with affordable health care and save the typical American family $2,500 a year.
And reduces every family's premiums by as much as $2,500. If your employer does offer you health care, then we're going to work with your employer to lower premiums by up to $2,500 per family per year. And cut the cost of a typical family's premiums by up to $2,500 per family per year.
Your own insurance. You keep your own doctor. If you like your plan, you can keep your plan.
It's happening because bare bones plans that don't cover everything Obamacare requires are now banned.
My insurance policy has been canceled. The White House website says if you like your health plan you have, you can keep it. Did I hear it wrong?
Again, sir, I don't know how long you've had your policy or
why aren't you losing your insurance?
Pardon me?
Why aren't you losing your health insurance?
Because I'm part of the federal employees.
Why aren't you in the exchange? Plan. You're in charge of this law, correct? Why aren't you in the exchange?
Because I'm part of the federal employee health.
Why aren't you?
Actually, any insurance that you currently have would be grandfathered in so you could keep. And so you could decide not to get in the exchange the better plan. I could keep my Acme insurance, just a high deductible catastrophic plan. I would not be required to get the better one.
I happen to be a proponent of a single-payer universal health care plan. A single-payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately.
The public option is not your enemy, it is your friend, I believe. Let me also say that, let me also address a illegitimate concern that's being put forward by those who are claiming that a public option is somehow a Trojan horse for a single-payer system.
First, no matter what you've heard, if you like your doctor or health care plan, you can keep it. If you don't have insurance, you'll finally be able to afford insurance. And everyone will have the security and stability that's missing today.
And welcome back to Hannity. Now, in recent weeks, we've learned the hard way that the president flat out lied when he promised you, the American people, that you could keep your health care plan under Obamacare. And today, we just couldn't help ourselves. We had a flashback to the year 2009 when then White House blog, under the headline, "The Facts Are Stubborn Things," they tried to defend the so-called Affordable Care Act against Republican evil truth-tellers. One problem, the so-called facts they were defending were complete and utter lies. This is pretty priceless in retrospect. Let's take a look.
Hi, I'm Linda Douglas. I'm the Communications Director for the White House Office of Health Reform. And one of my jobs is to keep track of all the disinformation that's out there about health insurance reform. And there are a lot of very deceiving headlines out there right now. The president has been talking to the American people a lot about health insurance reform and what is at stake for them. So what happens is that because he's talking to the American people so much, there are people out there with a computer and a lot of free time, and they take a phrase here and there, they simply cherry pick and put it together and make it sound like he's saying something that he didn't really say. Now, for example, here's a clip that they probably won't show you.
Here's a guarantee that I've made. If you have insurance that you like, then you will be able to keep that insurance. If you've got a doctor that you like, you will be able to keep your doctor. Nobody is trying to change what works.
The country's been waiting for decades for action, and we are not going to let them down this time. So it's very important for you to have the facts. The clip that you just saw is available on www.whitehouse.gov, as are many of the president's statements and speeches. You should take a look at that, see what the president is really saying about health insurance reform and how it affects your life.
Nice try, Linda. Also, you may want to take down this video because it's still up there on the website today, and the lies continue to be debunked. And it started with the NBC News report that came out yesterday. And today, a Washington Post, well, they fact-check awarded President Obama's pledge about keeping your plan 4, count 'em Pinocchios, which is their equivalent of a whopper of a lie. Congratulations, Mr. President. You did it again. We continue with Democratic strategy.
7 years ago, Democrats and Republicans came together to make health reform a reality for the people of Massachusetts.
The backdrop, a reminder that, like Obamacare, Romneycare also had a slow start.
Within a month, only about 100 people had signed up. And today, there is nearly universal coverage in Massachusetts. And the vast majority of its citizens are happy with their coverage.
Well, Mitt Romney turned to Twitter to deny the similarities between his plan in Massachusetts and Obamacare. He tweeted that a plan crafted to fit the Bay State should not be grafted onto the entire country.
In the of healthcare.gov.
There's no denying it. Right now, the website is too slow. Too many people have gotten stuck. And I am not happy about it. And I take full responsibility for making sure it gets fixed ASAP.